Isabel. My name is Tiffany and this is Melanie. A little bit about myself. I started here at West Coast University in January of 2015 and I'm so excited to be finished in just about a little over 6 months. My journey so far in the nursing program has been challenging but yet so rewarding at the same time.
Hello, Professor Bell. My name is Melanie. A little background on myself. I started at West Coast University back in November of 2015. Just like Tiffany, I'm getting more and more excited with our approaching graduation date and cannot wait to become a nurse. This program has brought me a lot of great memories and I'm excited to see where I'll end up. So for the research we have chosen to do is about asthma and the risks from prenatal exposure to paroxysmal in utero. The title of the research article is called Prenatal Exposure to Paroxysmal and Risk of Wheezing in Asthma in Children, a Birth Cohort Study. The researchers in this study were conducted by Robordosa, Corvina, Sorensa, and lastly Olson. It was published in International Journal of Epidemiology.
So, Paracetamol, also known as acetaminophen, is a medication that is used for pain relief or fever reduction. It has an increased prevalence with children and adults with asthma, and new studies are showing that those exposed to paracetamol prenatally have a higher risk at developing asthma in early childhood.
This medication is often the pain reliever of choice from pregnant mothers, and even though the study conducted by Avon longitudinal study of parents and children associated with paracetamol use with an increased prevalence of asthma, it is still considered to have no phytotoxic effects.
So this study evaluated paracetamol use in uteral exposure in correlation with asthma in children at 18 months between 7 years of age. If there's prenatal exposure to paracetamol, then there's a risk for asthma or wheezing in childhood.
This research is still conducted because paracetamol is a common drug used in pregnancy to relieve pain. It is still considered to have no phytotoxic effects as mentioned earlier. Therefore, the study wanted to see if there was a correlation between paracetamol use in utero exposure and increasing incidence of asthma in children. If there is an increase in asthma in children with the use of paracetamol, it is imperative that the doctors become more aware.
The hypothesis is that if there is prenatal exposure to paracetamol, then there is a risk for asthma or wheezing in early childhood. This hypothesis is supported by a previous research conducted by Avon longitudinal study of parents and children. The results of the study were that there was an increased prevalence of wheezing in children. Even with the results of the study, it has not convinced the clinical community and it needs to be corroborated by other data. Therefore, with the results of this research, it can influence the medical community to prescribe a different pain reliever during pregnancy.
The major techniques used in this study were 66,445 women from Danish National Birth Cohort, all of which were recorded to have used paracetamol during pregnancy. The women were all interviewed when their children were 18 months of age. Of the 66,445 interviewed, 12,733 of the participants were interviewed when their children were 7 years old to check to see the prevalence of physician-diagnosed asthma/wheezing. The study also linked population with Danish National Hospital Registry with the hospitalizations related to asthma in children up to 18 months of age.
So the result of the study is that those women who used paracetamol during pregnancy had a small but significant risk for asthma or bronchitis in children in 18 months year old. Highest risk for developing asthma was during the first trimester of pregnancy, along with persistent wheezing. The study supported the original hypothesis that paracetamol is associated with an increased risk of asthma and wheezing. It also substantiates the ALS-PAC cohort study with some discrepancies.
Future studies need to be conducted for a long-term result of the use of paracetamol and effects of asthma in children. If the effects of babies in utero, it will have an effect as a child who will be using this medication.
Exactly. In addition, if paracetamol increases the incidence of asthma, what other side effects can it cause? More studies need to be conducted to assess the adverse effects of paracetamol taken while during pregnancy.
So the strengths of this study showed a slight increase of risk of wheezing and physician-diagnosed asthma in both 18 months and 7 years old. The study also showed increased risk of hospitalization related to asthma. Lastly, the data collected agree with the findings from another study, ALS-PAC cohort.
So there were a few discrepancies with the ALPAC cohort. The ALSPAC indicated highest risk of exposure in the third trimester opposed to the study at the first trimester. The study could not rule out other factors that could have caused asthma besides Paracetamol. In addition, the sample in the study was limited to the Danish national birth cohort. Because of that, it is not sure if the findings can reflect the target population.
The implication of the study was that Paracetamol crosses the placenta, which the study observed how there is an increased risk that relates to the fetus's inability to metabolize the medication.
We chose the study because asthma is one of the most common childhood diseases. There has been an increase of this disease over the few years, one of it due to environmental factors. There are many children who suffer from asthma, and there are a number of causative factors that relate to this disease. If we can find more links to asthma and wheezing, we can start to develop more ways to prevent and treat it.
The article was prevalent to the health concerns we are facing worldwide. If we have come up with new causative factors to asthma, we'll be better able to treat those patients appropriately. This article was not only just interesting, but proved a ton of information, informative information on research that will be key elements in our healthcare communities. Tiffany and I both feel that this was bettering us in the healthcare professionals overall.
We learned that there could be additional causative factors that are leading children to develop asthma. It is important for the parents and the healthcare providers to be educated on the risk factors associated with certain medications.
It is important for everyone to be aware that there are a number of causative agents associated with asthma, but the important thing is to seek out medical attention and follow through with any medication regime they are put on.
Okay, and that's it. That's our study.
Thank you so much.